nurse is admitting a client with right-sided heart failure resulting from pulmonary hypertension. Which clinical symptoms are most likely to be assessed? A. Crackles in lung. Remember this and you'll never get a heart failure question wrong again. To differentiate left and right-sided heart failure symptoms, remember that left-sided heart failure will have lung symptoms. So remember left lungs, left lung. Right-sided heart failure will be the rest of the body. So remember R. Right side, rest of body. Right-sided heart failure happens when the heart can't effectively pump blood to the lungs. This causes fluid buildup in the veins, which then gets pushed out to the tissues in the body, which is why right-sided heart failure will have symptoms regarding the rest of the body. So crackles is a lung sound, right? It's an adventitious lung sound. When will we see lung symptoms? With left-sided heart failure. So no, we would not see crackles with right side. B. Jugular vein distension. The jugular vein in your neck is bulging due to fluid accumulation in the tissues caused by right-sided heart failure. C. Lower extremity edema. I want you to imagine lower extremity edema. We would picture fluid buildup in their lower legs, right? Because edema is excess fluid in the tissue. We'd see excess fluid in the tissues with right-sided heart failure. D. Orthopnea. What is orthopnea? We'd have to know that orthopnea is difficulty breathing when lying down. Isn't difficulty breathing a lung symptom? Will we see this with right-sided heart failure? No, we wouldn't. So remember left lungs. E. Increased abdominal girth. Increased abdominal girth means that there's fluid buildup in the abdomen, which means we see this in right-sided heart failure. F. Pink frothy sputum. The Nclex loves using pink frothy sputum, but is this seen in right-sided heart failure? So any type of sputum would be associated with the lungs, right? Which means we'd not typically see pink frothy sputum in right-sided heart failure. Answers are B, C, and E.
Let's get over your fear of SATA questions together. So the question says, the nurse provides care for a client diagnosed with impaired vision. Which intervention will the nurse implement to meet the client's needs? So off the bat, you should be telling yourself or refocusing the thoughts that this patient has impaired vision. So it's their sight. It's a little messed up. It's not their hearing. Chances are they're going to give you something that has to do with implementing something for a hearing impaired patient. Number 1 says keep the voice even throughout conversations. So that's our first one. We know that keeping our voice even throughout conversation is a great implementation if your patient had a hearing impairment, but this specific patient has impaired vision. So this is false. Second one, true or false, is explaining the sounds in the environment and appropriate intervention to meet the client's needs with impaired vision. So they can't see everything. Explaining the sounds in the environment would be helpful for this patient. So this is true. Decrease background noise before speaking. So this is an intervention that's more appropriate for what kind of patient? Your hearing impaired patient. So 3 is false. Stay in the client's field of vision. That's a great implementation for them. So true. True or false, is it okay for you to identify yourself by name and staff position to help this patient with impaired vision? Well, that's true. If you're walking in there, it's going to help the patient identify who you are. So this is also going to be correct. So if you answered 2, 4, and 5, you got this right. If you need more practice with Nclex questions and you hate SATA questions, follow for more because we do these every day. So it says, a nurse cares for a frail elderly client with osteoporosis in a nursing home. Which interventions are appropriate to include in the client's care plan to help prevent a hip fracture? So before reading all of our options, we want to dumb down the question a little bit. So what is it asking? What interventions can we do to help this patient prevent a hip fracture, considering that they're old and they have osteoporosis and they're at a nursing home? So now we'll do this one at a time. So think of each SATA option as its own true or false question. So that first option, it says calcium supplements, and ask yourself, true or false, are calcium supplements appropriate to include in a care plan to help prevent a hip fracture? Well, what do we know about calcium supplements? We know that in combination with vitamin D, that can help increase patients' bone mineral density and also to prevent bone loss. So that's true. Let's look at the second one. Encourage bed rest. We know for sure that encouraging bed rest or immobilization is actually going to make this problem worse. So that's false. Use of full bed rails during the night. That's a restraint. Absolutely not. We know that's false. Then vitamin D supplements. We know that's true, right? Because in combination with calcium, again, the same thing, we're preventing bone loss and we're also increasing bone mineral density. And let's look at the last one. So it's weight-bearing exercises. So we know that things like walking, things like dancing, when we're increasing mechanical stress on our bone, we're increasing bone density. So that's true as well. So it will be 1, 4, and 5. If you got that right, great job. Follow for more and comment what other things you guys would like to see.